Welcome to 27 Topics. Our guests today are from Memorial Hospital Healthcare Center here in Jasper, and we're going to be talking about the CT scan and the Women's Center. Our guests are Elaine Schuetter, Director of Radiology Services, and Stephanie Allen, Supervisor of the Women's Center. Welcome.
Good morning.
And it's great to have you here.
Thank you.
Tell us a little bit, first Elaine, a little bit about yourself.
Well, I'm the Director of Radiology Services at Memorial. I've been employed there since 1979, and we have a very interesting and dynamic department. It includes diagnostic or plain film X-ray, CT scanning, MRI, nuclear medicine, ultrasound, PET CT, and all the Women's Center services such as mammography, ultrasound, bone densitometry, and ultrasound.
Stephanie, tell us a little bit about yourself.
I've been employed at Memorial since about 1997, and I've been the Women's Center Supervisor for about 5 years. I used to work in the department amongst all the other modalities, but now I work in the Women's Center. I oversee the flow and help do patient follow-up and things like that.
Elaine, I think you've been there a number of years.
Mm-hmm.
It's not the number of years, but the changes that you must have seen in the hospital and this department.
I did. Not only did when I started there, you knew everyone by name. Now we're up over 1,200 employees at the hospital. And then as far as the hospital itself, it's grown, as most people in the community know. As far as radiology, when I started there, we had a 2-room X-ray department, no CT scan, no MRI, a mammography machine that we only did 1 or 2 patients a week on at that time, and now we're doing over 50 a day. Nothing as far as any of the other technologies that's come out. So the hospital is doing great things, and it's wonderful for the community because we can keep the patients here instead of traveling. So we're pretty proud of everything that the hospital has accomplished.
Oh, I think that regionally we should be very proud, and certainly currently always current with what is the best for the public.
Mm-hmm.
And I think that's great. And the one thing that I think that you're here for today and that everyone is excited about, and I've heard of people talking about, and that's the CT scan.
Mm-hmm. Yes, we just got a brand new CT scanner last winter, and we're very proud of it because it's state-of-the-art technology. It's a 64-slice scan piece of equipment, and what that means is that not only is it faster, but the amount of information that we can acquire is different and gives the doctors a lot more detail and resolution for them to make the diagnosis from. So, for example, we do cardiac scans, and we can get the scan done in so many seconds. Within like 3 heartbeats of the scan, we can complete it, and then later we can render it into volumetric imaging, if you will, so that they can actually, on a workstation, rotate the heart around and look at it from different angles, and even takes the best way to describe it is taking a slice of it so they can look down inside the vessels and so forth. It's very, very wonderful.
And so that's how, tell us a little bit more about how it is used in the heart scan. I mean, what do they, when they do that, or what particular things are they looking for?
Well, they're looking for blockage or even narrowing so that they can predict, and get the person some treatment, whether it is anything from medication to a stent in the heart to even open heart surgery. And hopefully we can, see that before somebody, before it's too late for someone. We've got great cardiologists here, and we're building that program too. So this scanner is just a tool for them to help them in what they're doing.
If somebody has a heart attack and is rushed by ambulance to the hospital, I guess the first thing is they're in the emergency room and stabilized. How long does it take for, I guess, the steps to go through to get the scan? And
Well,
I mean, is that days maybe, or it depends on the patient?
No. We do patients from the emergency room as needed. You know, we have to fit them in between scheduled patients for obvious reasons, whether it's the heart or, you know, brain or for a stroke or whatever. And it depends on what the doctors assess at that time, whether they would go straight for a CT scan or if they would go to the cath lab. It just depends on how critical things are and what kind of medications they need to give them right at that time. There's a window of opportunity for certain types of medications and so forth. So it's all up to the doctors on that one.
It's being in the know, right? You know, if a patient comes in there, I mean, you know, I know they're kind of excited.
Sure.
And you have to tell them some things, you know, what is a scenario for a patient?
As far as, are you talking about heart attack victims or?
Yes,
Okay.
Cardiac.
Well, the nurses and the doctors in the emergency room do a good job. They try very hard to keep them calm, to give them medications that they can to keep them calm. And then as far as the cardiologists go, they're very good at staying calm themselves and explaining what they need to do to the patient, and they're very inclusive of the family to talk to them about what needs to take place. And then, you know, they just do not care to waste any time, of course. You know, as they go through that. But it has really been a wonderful thing for the patients who, you know, as we were talking earlier, 50 years ago, people just weren't around as long. So all the technology is helping that. What
are some other uses of the 64-slice CT scanner?
Oh my goodness, we have many uses. Anything from, we do a lot of abdominal work, you know, say somebody hasn't been feeling well or they've had certain symptoms that may be indicative of maybe a cancer or even an appendix or any of those type of things. You know, we can scan the whole body. We do a lot of head work for, you know, possible stroke, those type of things. We do extremity work. You know, it depends on what's going on with that patient. And a great example is cancer patients have to have a lot of things like this to check on progress and see how things are, what it looks like, those type of things.
Let's move on to discuss breast cancer a little bit and the type of methods of diagnosis.
Usually a lot of women are coming in for their screening mammograms. More women nowadays are more apt to come in for their screening, and so we're screening more women. And usually they come in for a screening mammogram, and then if we see any area of concern, we'll have them call back and take additional pictures and things like that. And then if the radiologist feels necessary, then we'll do a biopsy of that area. And then if it proves positive, then we get them in to see a surgeon and get that process going as quickly as possible for them so that they don't have any more concern and can get treatment started as soon as possible.
Of course, and you're talking about new equipment too, the new digital mammography.
Yes, we just started about a month ago with it. For the patient, it's still the same. We still have to compress, but it saves some time. The images come up on a computer and we don't have to go process the films. We can see the images quickly. And then when the radiologist views the images, they can manipulate them and also see much more detail than we have previous and can detect things much more sooner than.
How much better is this than the older equipment?
It's much better. We as the technologists love it. We can, you know, we can see things so much nicer and clearer than we had in the past. And like I said, we don't have to process films. That, you know, saves us a lot of time for the patient and for us. And it's just, all the techs have just been very excited about working with it.
At what age should women have their first screening mammogram and the frequency of mammograms thereafter?
Usually they say between ages of 35 and 40, you know, to get a baseline unless you have a significant family history, and then yearly after age 40. Regardless of your family history. Every woman should have one after age 40.
Age 40, and the frequency depends on the findings?
Yes. Most everybody's yearly. If they're concerned about an area, they may watch it a little closer for 6 months or so, but as soon as they determine that that's stable, they'll get you back on your screening mammogram then.
What is the process for scheduling appointments and the change in patient registration process?
Well, for an appointment, you have to have a physician's order, and with breast cancer, it's very important that you do self-breast exams, clinical breast exams, and mammography. So, we like for the ordering physician to do a breast exam prior to them coming, but they do have to have an order from them. And then either they or their doctor can call centralized registration, and they will get that scheduled for them. And then we are located right inside the pavilion entrance, but everybody needs to go to the main registration and register prior to coming into the Women's Center. And then once we get you in there, we'll get everything going.
I guess other than emergency, everyone needs to go to the front desk. Is that correct?
Correct.
Yes.
And what particular information should they have with them when they come in?
They should always have their ID, their insurance cards, and then Medicare age people need to have that type of information with them. Another thing that's helpful, especially if they're going through the emergency room, is to have any type of medications that they're on. They should have that in their wallet. That's always a very good thing to have with them.
Sometimes you hear people say, I was just in there a month ago and they had my records.
Mm-hmm. Well, things change and they need to verify that. And most often they do have most of that information, but they have to verify all of that.
I know there's 20% of the public supposedly moves every year. And, they may think you have the correct information, but that does not follow through all the time.
Exactly.
Tell us a little bit more about radiology and the size of the wing.
Well, we're very proud of it. We just moved in January of 2005 to the tower, the patient tower, and we're proud of that whole area, the new OB and the ICU and so forth. It's just been wonderful for the patients. It's nice for the radiology patients because they come in the front door and can go right there, where before it was go up this hallway, go up the elevator, those type of things. We're very blessed with the type of equipment that we have and the amount of people that we have working there and the services that we give. I think most people, when they think of tests, they think of radiology, it's hard, cold tables and so forth. So we try our best to make it as comfortable as possible and to get the test done as quickly as possible, and of course with good quality images and speed.
How many procedures do you think you may do in a year? You mentioned
I
the
know
little
how
thing,
many
a
we
day?
Last year, our fiscal year, which ended at the end of June, we did over 61,000 procedures. And so that's a lot. It's a whole lot of X-raying going on.
That is an immense amount of, boggles the mind.
Well, speaking of that, we have 5 radiologists which do an excellent job, but it's a lot of brain power. And so another thing that we got about a year ago was PACS technology, and that is all of the x-rays are computerized. And so the radiologist can sit there in front of a computer and bring up all the images. They can also manipulate the images and compare them to old images. They can blow parts of them up to look at them with more detail. So that's been a tremendous help, not just to our department, but in surgery, they can bring up the film on a computer monitor there. The doctors can in their offices, the whole thing. So it's really been a big improvement.
Elaine Schuetter, Director of Radiology Services, do you have any closing comments?
Just, I encourage people to educate themselves as much as possible, talk to their doctors, not to be afraid, because we'll take good care of you when you come in. And we're very excited to have this for the community and appreciate the support.
Next, Stephanie Allen, Supervisor at the Women's Center. You have some closing comments?
Basically the same as Elaine's. I know a lot of women are afraid to get a mammogram. They've come in, they've heard horror stories and things. Most of them, when we're finished, say it was not near as bad as they had anticipated. So even though you're afraid, we'll get through it. It's, like I said, not near as bad as you anticipate, and we got a lot of techs give extra TLC and get you through it. So just make sure you come in and get it completed.
Probably the people coming in are more of the older age. No, they're not.
No, I think
that's interesting.
This we have a new generation that is much more proactive and preventative maintenance or preventative medicine, and so they are coming in more and on a yearly basis. Our average age mammogram is probably about 45 to 50, really.
Well, statistically, 1 in 8 women will get breast cancer in their lifetime. So it's very important. Early detection is the best prevention.
Of course, my thing would be the fear is of the older generation more so than the younger generation.
They're pretty tough. They
Yeah.
do pretty
Oh,
well.
Yeah.
Well, I want to thank you for being our guests on 27 Topics.
Thank
It certainly
you.
is a
Thank you.
pleasure, and we certainly are thankful for Memorial Hospital and Healthcare Center.
All right.
Thank you.